Hello, how are you? Unfortunately, the prevalence of colon cancer has been increasing significantly among various population groups, especially in people aged 50 or younger. In the past, it was a cancer more commonly associated with older people, but nowadays, we've been noticing an increase in the general population, even among younger people. Why is this happening? How can we prevent this and avoid a cancer that can be fatal for many people? This video is very important. Stay until the end, you won't want to miss it. Before we start, I want to ask you, how old are you? Have you ever had any kind of test to check for intestinal problems? Do you have anyone in your family who has had any kind of intestinal issue, cancer or polyps? And have you ever been to the doctor to find out when, in your case, it would be recommended to get tested? I would love to see your comment. It's very important to talk about this because in recent years, we've been seeing more and more cases of young people in the media who have been dying, or at the very least, suffering a lot from colon cancer. And when we think about young people, we're really talking about people under 50 years old, including cases of people in their early 20s who start having problems with polyps, rectal bleeding, and other related issues. And when they go to investigate, the cancer has already started there. We know that colon cancer is often a silent cancer, and that's its biggest problem because many times people only seek a diagnosis or get a preventive exam when they already have some symptoms. And that's a detail I'll talk more about with you later. So, it's very important to already be thinking about prevention. It's a cancer that can be prevented if you get tested earlier and earlier. One important thing to mention is that normally the recommendation is for the exam, the colonoscopy, to be done starting at age 45 for the general population. But if you have a first-degree relative who has already had colon cancer, ideally you should get the exam 10 years before the age at which your relative was diagnosed with the cancer. So, let's suppose you have a father or mother who had colon cancer and this person was diagnosed with cancer at age 47. You need to get the exam at age 37 to check if there are any problems, because specialists estimate that any type of pre-malignant lesion you might have, such as a specific type of polyp, can take up to 10 years to turn into cancer. So when you have a colonoscopy early on and they find a polyp or some unusual structure, they can already remove it. Colonoscopy is a very interesting exam because besides examining and diagnosing, it can also remove the polyp right then and there. So, after removing the polyp, it is sent for biopsy and analysis to check whether it was actually cancer, a pre-malignant lesion, or just a hypertrophic polyp with no issues at all. There are also polyps that are benign, so to speak, many of them actually, so you can already determine what type of polyp you have and your predisposition to develop them. Then, based on that, you can proceed with the appropriate treatment. The main point is that even if it is a pre-malignant polyp, if you have removed the polyp, it cannot turn into cancer because you have taken out that structure. So it is very, very important to get the exam done because nowadays it is the only way you can be sure that you won't get cancer. Of course, if you have already had some kind of diagnosis or had a polyp removed in a previous exam, you will need to have exams more frequently. Depending on the type and number of polyps you had, your doctor will recommend a specific interval for you to repeat the colonoscopy. Normally, if you don't have any problems in the colonoscopy, the doctor will say, so in 10 years, we'll do another exam. But if you've already had a polyp removed, they might say it needs to be in 6 months, in 1 year, in 2 years, or 3 years. It will depend on the type and number of polyps you had. This is always determined by the specific doctor who performed your exam. More and more young people are being affected by this, right? As I mentioned to you, the symptoms are starting to appear in younger people. So if you have any of the symptoms I'm about to mention, it's extremely important that you see a doctor and check if, in your case, it's already advisable to have a colonoscopy. So a change in your bowel habits. If you used to have very sluggish bowels and now they're becoming very loose. If you used to have very loose bowels and now they're becoming very sluggish. If you alternate between constipation and diarrhea, that could be a sign. In fact, many young people end up treating it on their own as if it were irritable bowel syndrome, but see no improvement because it could actually be some type of polyp or some structural change already happening in the intestine. So this is a very important warning. Second thing, very thin or flattened stools, depending on the size of the polyp, the lesion, or the cancer, especially if it's closer to the end of the tract. If the tumor is in the same portion of the rectum, it can take up a large space in that tube, which is the rectum, and for the stool to pass through, it has to squeeze underneath, so it comes out looking like a ribbon. This is a very important point. We need to look at our stools, our excrement, because they tell us a lot about how our body is doing. Another extremely important thing is the presence of blood in the stool, whether it's fresh red blood or dark brown blood that's already clotted. It's important that you see a doctor. Don't assume it's hemorrhoids. Don't assume it's because your stool was very hard and it hurt you when you were having a bowel movement, when you were actually passing stool, eliminating stool. Don't assume that. Rectal bleeding is not normal, especially if it happens several times in a row, right? Several days in a row and several consecutive bowel movements. So if you notice blood in your stool, it's important to see a specialist. If you also have recurring abdominal pain or cramps, of course, that's a very non-specific symptom. But if you have a feeling of incomplete evacuation, like you want to go to the bathroom, but it feels like something is still stuck, and especially if you've been experiencing unexplained weight loss, all of these can be symptoms of cancer. Then people want to know, why, after all, is this happening to younger people? There still isn't a scientific consensus on why this is happening, but there are several types of speculations from the scientific community. First, it's because of the excessive meat consumption that the population has had over time. When we stop to think about our grandparents, the amount of meat they consumed, processed meats, smoked meats, and even red meat was much less than what we eat today, right? In the past, meat was almost like a luxury item. So people would put a lot of vegetables on their plates, lots of beans, lots of pasta, lots of potatoes, a lot of things that were filling, right? There was plenty of food, lots of cornmeal, lots of polenta, and meat was just a tiny portion, just a part of everyday life, along with the vegetables. But it wasn't like it is today, with people sometimes eating 7 or 10 ounces of meat in a single meal several times a week. I even have a video here on the channel talking about how many times is ideal, what science recommends for us to eat red meat per week, and I'll leave the link down below in the description. And remember that red meat is harder to digest, it stays in the intestines longer. But even worse than red meat are processed meats, which have seen a big increase in consumption over the years. These meats are cured, smoked, processed, contain curing salts, and are already considered potentially carcinogenic. They are classified as potentially carcinogenic, so if you have a family history, it's best to consume as little as possible. We also know that sedentary lifestyles and obesity, unfortunately, have been increasing over time, especially among younger populations. It's very common nowadays to see young people who spend many hours a day sitting while working, right? They're really caught up in the daily rush. Often the work is intellectual, so they sit for many hours and don't have the time or energy to exercise because everything is so demanding and hectic, and this can also increase your risk factor. We also know that changes in the gut microbiome, that is, dysbiosis, and even repeated exposure to antibiotics can lead to this alteration in the microbiome. And this can increase the risk of polyps and even intestinal cancer. So having a balanced diet is super important. Properly nourishing your gut is important. How can we properly nourish our gut? Probiotics like yogurt, kefir, and fermented foods. I have a playlist about them here. If you want to make them at home cheaply, I'll leave it down below for you. The gut loves fiber. Fiber helps the gut function well, so eat plenty of fiber. Chia, flaxseed, psyllium, vegetables, legumes, leafy greens, and fruits with the peel. These will always help you a lot with gut health. Plenty of water will also help because fiber needs water and the gut loves water. The gut needs to stay well hydrated to function properly. And of course, reduce the harmful agents. I've already mentioned cured and processed meats. Alcohol and tobacco are terrible for anyone who has any kind of cancer problem or a family history of it. So, if you can improve this, it will definitely make your health better in a broader way. Remember that I have many videos here on the channel talking more about this. And there's an entire playlist about digestion and gut health. I'll leave it down below in the description for you. Let me know down below, did you already know that your diet and your lifestyle had such a big impact on this issue? And now that you know, would you make any changes? What would be the hardest thing for you to change in your routine? I would love to see your comment. Like the video to help me out and share it with those who might enjoy it. Let's grow this chain of kindness together. That's my goal for this channel. See you next time. Bye.